This is the Authority Company podcast, conversations with leaders that are designing our future. Hola, I'm Joe Pardavila. And did you ever want to dig into a subject, but were too intimidated to get started? I remember a little while back, I wanted to read up on the Civil War, and I Googled best Civil War book, and the one that came up was Battle Cry of Freedom by James McPherson. It was a Pulitzer Prize winning book, had amazing reviews, and then when I got it in the mail, it was 900 pages long. I developed a lower back problem lugging that thing around, so I kind of stopped halfway through it. But the reason I bring this up is there's a new book about healthcare, and I know people want to learn more about it, but again, like me, are intimidated to get started. But I've got one that's a great introduction for anyone who wants to know more about the healthcare system. It's called The Center of the Star, Understanding and Changing the U.S. Healthcare System. It's written by Judith Kunisch, who's an executive leader, healthcare strategist, and educator. We got a bunch of topics to cover that are in the book, including our response to COVID-19, big pharma and the cost of pharmaceuticals, and whether healthcare really is too big to fix. Judith Kunisch, welcome to the podcast. How are you?
I'm good, Joe. Nice to meet you, and thank you so much for the time.
You're very welcome. And, one of the things I wanted to get into quickly about your book is a word you use that I don't often see used in terms of the healthcare, sphere. And that's the word consumer, because most people think of it as patients, but you use the word consumer, and it got me thinking. And it's funny because I think now, as long as you don't live in sort of like a healthcare desert, you are a consumer. You have choices. You don't have to stick with one doctor or even a medical kind of like facility that's a particular affiliated with someone. You can go and pick and choose. When did you come to the realization that patients were more than patients, but they were actually like shoppers, like they were consumers when it came to healthcare?
Well, I'll tell you what. I'm gonna take the word consumer because I do write about this, and I compare it to the word customer. And a customer is somebody who goes out and buys something and who knows what they do with it. They might bring it home and use it, they might not. But a consumer has a responsibility to use it. And so when I write about it in terms of healthcare and getting healthcare, we do have a responsibility ourselves as consumers to not only to select the healthcare that we want, but to take care of ourselves, follow directions. And I go into more detail about this, but I'm very, very sure of the fact that you're a consumer. I describe patients, but they're generally more acutely ill, have a problem at the time. But on the consumer side, you're using healthcare, but you are also participating in it. Make sense?
Yeah, no, I love that. And it's so funny. So our company is switching healthcare system, whatever you call it, coverage. And then I've been going through this rigmarole of like trying to take advantage of my benefits that I had from my previous carrier to like the new one, and trying to, and I'm relatively healthy, middle-aged man, so I'm not going to the doctors much. So I'm like, hey, I've already contributed enough. Let me just see what advantage so I was looking at like working, trying to figure out like my eye benefits, and then trying to like decipher like what is my password for my eye benefits, what account number, and then that's managed by another company. And then it's so the reason I'm going off on a tangent, Judith, is like, why is it so complicated? Why are there so many things for people to keep up with? And if you're healthy, it's almost like it's more of an annoyance. But when you're not healthy and you're dealing with issues, the last thing you want is complications. Judith, you've been at this game a long time. Why is it like this?
Well, here's a couple of things I'm gonna say right up front. Number one, it's the second largest industry in the largest economy in the world. The healthcare is an industry, and it's the second largest in the largest economy in the world. It's big. So when you describe all those moving parts, that's exactly what it's made up of, is a lot of moving parts. Now, I'm going to leap over to the title of the book and explain those parts a little bit, because the title of the book is called The Center of the Star, understanding and changing the U.S. healthcare system. So here it is, my star. What I did is, and I did this years ago, I looked at the whole healthcare system and I broke it into its different segments, its sectors. And there's actually 5 of them. And one is the patients, consumers. One is the payers. You mentioned it. Listen to what you were describing in your example there, the payers. Then there's the providers who give the care. Then there's the policymakers, the regulators, and then the health industrial complex where we do a lot of chemistry, we make drugs, etc. And I had laid those out and I drew arrows between them. Son of a gun, it came out as a star. And so it was this. And what I learned in my work is that when you make change, and everybody wants it to change. I couldn't agree with everybody. Of course, we wanted to change. It's complex, it's difficult to use, it's hard to understand. I said, you have to make your change from the center of the star. If you just think about one little area and make the change there, it oftentimes isn't successful. It may start out, but it isn't sustainable because you haven't involved these other things. So, do you want an example right up front? Okay. So, all right. So I'm a healthcare provider. I am a nurse. I graduated from college with a nursing degree and I worked at the bedside. And then I wanted to have more say in what was going on. So I got a master's of business administration and I stepped up into leadership roles and management. And I moved around to many different jobs and areas. I worked in a lot of those sectors and I learned a ton, which is why I wrote the book, because I want people to know what kind of goes on behind the curtain. So I had this one job, and this is my example of the star and thinking from the center of the star. I had a job. I lived in Hartford, Connecticut at the time. We had very high infant mortality rates. Babies were dying. And we knew that there was something that we could do with women while they were pregnant and at risk to help them not have a very low birth weight baby. So we got these wonderful grants from the Kellogg Foundation, the Centers for Disease Control. I mean, we really got it started. We had nurses, extra nurses, providing this model of preventive care in clinics. They even got into soup kitchens and shelters, finding pregnant women, working with them. We were doing great. We were collecting data, fortunately. And after about 3 years, the grant started running out and we didn't have the money to pay for it. And we went, whoa, what are we going to do? Well, we needed to talk to the payers and the policymakers. And so it took us a couple of years, but we got around the table. We got policymakers from the state of Connecticut as well as from the city of Hartford. And we got payers around the table, including Medicaid, a hot topic right now, as well as private payers. And we got the service paid for. And so we converted grant-funded services to what we call hard dollars, billable services. And that was getting in the center of the star to make this effective change. We providers down here were doing a terrific job. We were doing a great job for our patients up here, but we hadn't figured out how to work with the other ones, and that's when the grants were running out. So I use that example in the book as one of the reasons I got going on this, is because once I got around the table with all these other people, they were very interested in what we were doing, and they were very interested in our results, and we were really interested in the fact they were gonna help us get hard dollars so we could make it a billable thing.
Wow.
And it worked.
Yeah, it sounds very easy, Judith. Much like me trying to figure out my password for my benefits, it's almost like it's the same thing. And it's funny, you did mention a part there about government funding and the CDC, and you are the expert in this. I am not, but I am aware that the government seems to be taking a step back from healthcare and leaving it more to the public markets and commercial companies. You mentioned the fact that you ran out of funding. What's going to happen when we don't have sort of this safety net of the government pitching in to help with some of these issues that maybe not all commercial healthcare companies want to get involved with, but could be important down the line. Like you talk about the low birth rate mortality. There's going to be some things that good old capitalism is not going to want to be involved with and maybe may need government intervention. What is your feeling on that now? Again, and we don't want to get too political here, and I know that's a cliche at this point because everything is political, but like, is that a worry to you in terms of this harsh separation of church and state between government and healthcare?
No, I'll tell you why. The government will never get completely out of healthcare, and, as much as people talk about it, and it's a hot button item right now, but the government will not get out of it. The government actually started getting involved in healthcare way back, in the 1930s and the 1940s. I actually have a little chapter on that. When you take on the healthcare system, you're either gonna write a book of 1,000 pages. Mine's 205 pages, and it's important. Because I wanted to hit the big items and give enough of an explanation to it, but not go so far down in the weeds that it, became something that, only experts were gonna wanna read and stuff. So, back to the government, I do talk about the role of the government and what percentage of the federal budget goes to Medicaid, Medicare, the SNAP program, all of those things. Huge percentages, huge percentages. And, the government won't get out of it. It won't get out of it, and, I think it's a political item right now, but I can assure you that what they started back in the 1930s will continue, and we will continue to take care of people, and, I also explain how it's priced. I go into details about the pricing models, how they're set up, how the bills are done, and it's complicated, but it's not that complicated that I couldn't explain it. And I've had people say to me, "Whoa, who knew?" I said,
Yeah.
"Right."
Well, that's great. It's speaking of the government and healthcare. You talk about COVID-19 in the book, and one of the things that it's I don't know if maybe it's we've kind of now plus 5+ years of it. That there is a sort of general understanding that man, we didn't handle it right. Like generally, I mean, I'm sure elements of it were handled well, and I'm sure you know more about that than I do. But there is sort of this attitude of like, man, we blanked that one up. Like as other government or society. Well, and when you hear stuff like that, what's your take? Because you were in it, but like, do you think that we did things better than others? What's your take?
Well, I'm right about this. One of the things that happened is that the model of care in our country became an acute care model, meaning if you were sick, there was big pharma, there was the hospitals, there were doctors, they could take care of that. But we dropped the concept of what we call public health, preventive health, keeping people healthy, or even maintaining people that may have a long-term chronic illness, but they're not sick. They don't need to be in the hospital. They take their meds and follow their treatment guidelines. And so what happened is that kind of that became second rate. And there's a couple of pieces of major legislation that were passed, but one of them was interesting. It was called the Hill-Burton Act. And it was passed, I believe, in 1948. It went all the way through 1997. And the goal of it was to build a hospital in every town in the country. Now, hospitals do acute care. They don't do preventive care. They don't do public health. So back to the COVID piece. COVID was about preventive care, public health. We didn't want it to become acute. I mean, if they got acute, they went to the hospital and it was, I had colleagues who worked in the hospitals at that time. They were overwhelmed. But at the same time, we had millions and millions and millions of people that didn't get it. And how did we keep them from getting it? Now you go in the bathroom anywhere and they say hot water, wash your hands, and people wore masks. And we really got into much more preventive health, which is preventive care. Back to my consumers. that's part of a consumer model. So that's what I write about. Make sense?
Yeah, no, and so you, what do you think? Let's try to be a little positive about. You mentioned the preventive stuff about like telling people how to wash their hands. Wear the mask. If that again, that became whole political football in itself. But what are some of the things that we did right during that time?
Oh, I think we did some really great things. I do write about big pharma, and boy, they stepped up to the plate. And in the pharmaceutical industry, I don't think people realize it. It takes 10 years to get a drug out, to really go from the what we call the bench to actually using it for everyone. That's a 10-year period. Well, they had been doing some work on RNA, et cetera, and they were able to get out those vaccines much, much earlier than that longer period of time. Now, I also write maybe we should think about that for other drugs too, but that's maybe the statement I made. But that was a very important part of it. The other thing that I think that we did really well was the awareness. And at first people were wearing masks, people were really being very, very careful. Thank heavens. I mean, I think that we really did a superb job getting the word out and helping people with that. And, I mean, allowing you to self-test. Could you imagine the doctor now saying, "Oh, go self-test yourself and, let me know what the outcome is?" Well, they did in that with COVID. They said, "Get the self-test, go to the drugstores." Some of them, the government sent speaking of the government sent out tests to people and had them self-test. So we did a lot of moving quickly. And back to my star, down here, this health industrial complex, which sounds, rugged or whatever. That's where a lot of the work came out of to get this public health moving quickly and quickly. And it really did move quickly. And it was not only that, it was successful. It was very successful.
Awesome. Yeah. I mean, be one of these negative Nellies that we screwed everything up. But I do know now that we have time separating from us, we could now hopefully learn from what we did right and what we did wrong in that time. Because as many people have in the science community have agreed that it's probably not the last pandemic we will probably ever see in our lifetime. So
You're
hopefully we'll be
correct.
able to learn from that. You mentioned big pharma, and I guess part of the whole big pharma argument is costs. And Trump's getting involved in costs of medications. I know Biden put a heavy foot on it as well. How is it so out of control? Like that some medication, like, pick and choose whatever medication, whether it's a basic insulin being cheaper to go to Mexico than getting it here. And there's so many examples of that. And then you had that, farmer bro from a few years ago, that Martin Shkreli, who had that drug that once he took over the company, decided to 10x the price of it. And so you hear about obviously the bad actors, and you mentioned the good actors, like how they were able to figure out the mRNA vaccine in such a short amount of time. But the cost thing is the one thing that they really can't escape from. And obviously you write about that in the book, but tell me about your thoughts on that.
Well, I was out to dinner last night and somebody was asking me about the cost of big pharma. It just goes on and on and on. Here's what I say. Um, the 10 years from the bench to getting it out costs money. It is not done, now a lot of these companies are for profit. They're certainly for profit, and they're also publicly owned. And so you do have investors that you've got to pay off, but that's a small percentage of it. And I will tell you this, on any reimbursement, the government says that you have to spend 85% of what you on the dollar for delivery of healthcare. The other 15%, this is sort of getting over the payer side. The other 15% you can use to run your business and your operations and do your research, et cetera. So the same thing with big pharma. They apply that money to more research, getting stuff back off the bench. The bench means being on the bench is when you're doing the scientific investigation of it and the research, moving the process along. I'm not defending them. And by the way, in my book, I don't defend anybody. I also don't take anybody down. It's an apolitical book. I don't get into politics, and I'm not biased. I just trying to tell people this is how it works. And if you want it to change, you need to understand how it's constructed, how it works. And that's so important because people want to eliminate things. And I say, you may eliminate something that's very important that you just didn't know about. And I'm not saying you, the reader, I'm saying you, the healthcare providers, or you, the policymakers, or you, the payers, or so it's so complex, and to try and divide it out and to just show these pieces, including how pharmaceutical dollars are spent, why they are the way they are, and I also write about the media. Um, because they certainly influence us greatly. And they're very much they're not one of the 5 sectors of the health system, but they're in the 5 sectors writing about them. And oftentimes not standing in the center of my star and understanding how the pieces come together and how they work together. And that's it's a problem because then you get people that are believing things that are only maybe half true or half reported. And the other, as I say to people, I try to pull the curtain back and let people see what's going on behind it based on my experience. I told you I started at the bedside, and then I worked in Harlem as a public health nurse. That was, way back when I was gonna make the world better,
Mhm.
and I learned with my first patient that I was probably gonna learn a whole lot more from my patients than I was ever gonna learn and teach them. But I ended up the vice president of a Fortune 100 insurance company. And so that moving across that experience of the healthcare system allowed me to step back and to be able to say, "Whoa, this is the way it is." I also want to make one more comment. I had a very interesting opportunity in my career that, again, I had never planned to do. I became a faculty member. And I was a faculty member at Yale. And I remember going to my first faculty meeting and I said, if my friends could see me now, this is just not who. But I ended up being at Yale for 12 years and working with graduate students who were all geared for executive positions, administrative positions, managerial positions in healthcare, and teaching them about how the system worked was really eye-opening to them, very eye-opening to them. And it was important. It's very important for people to learn how this thing works.
That's awesome. It's funny. You talk about the system, and we went into COVID and the government and what the healthcare systems can do. But I always feel like even going back to the COVID thing, where there's a will, there's a way. Like if you think about what like Nixon did in the early '70s, where he signed into law where people can get dialysis treatments at relatively no cost. Why do you think? We've talked about how impossible it may be to fix it, but like if we really do set our mind to something, we can get stuff done. Like millions and millions of people are alive today because Congress and Nixon decide to write that into law where people can get treatment for dialysis and kidney transplants and such. I mean, I know that's one small piece of it, but why don't you think that sort of attitude or gusto, even like with COVID, like where everyone kind of was all on the same page about like, hey, let's get these vaccines out there relatively quickly. Is it just because of the money? Is it the politics of it? Why is that there's certain things we can do, but we can't? We could almost take like it's like the old entrepreneurial adage, how to eat an elephant one bite at a time. Like, is it that we just have to just take care of these things one little bit at a time as opposed to trying to fix it all at once?
I agree with you. You are 100% right. You have to look at it. You have to it's not gonna get fixed overnight. One of the books, and authors that I quote is a woman, of course, you think I can't think of her name right now. Um, but the book is called The Long Fix. And what the thesis is that it's gonna take a long time to fix this, and I couldn't agree. I said I quote her in the book, because it's true. It's a huge, huge system. It's very complicated, but it can be changed, and you know what? People are making change all the time. It's not like they're sitting there stagnant, not changing it. They are making change all the time, but it takes time, and it because back to the largest economy in the world and the second largest industry. If you think about it and you think about your change and you start getting these pieces, so back to the story of the high risk pregnant women, it took us 2 years to convert to the hard dollars. It wasn't click your heels and be a and get there. It took 2 years, but we did it, and it still exists now, years later. But I think and back to the press, this get the job done and get the job done. Politics, oh, hot item, get this job done, get this job done. Okay, yeah, fine, that's great. Now let us get the job done, but let's do it in a rational fashion that has a degree of success involved in it. And the other thing that I think that, and I write about this a lot, is getting around the table with people who are not from the same area of expertise that you are and listening to them. There's a very famous Drucker he was from Harvard and he was quoted and he always said, and I used to put this up as a slide for the students on PowerPoint. And its saying was, listen first, speak last. And it's very important that when you're sitting around the table with people from an industry that is so different than yours, and I had the privilege of doing that, I learned so much from them and they learned from me because we all listened and we worked together.
That's great. That's great. You are clearly optimistic about this. I think most people that have spent as much time as you did, maybe harden and jaded and put their hands up, be like, ah, too big to fix. Um, I'm curious, like, where does that come from? Was there a moment across the sectors that you worked in, from like the bedside to academia to working in the industry? Like, was there one moment that filled you with that optimism and has stuck with you throughout the years? Because, like I said, you're in a tough business. No matter what, every part of the business you worked in, whether it was teaching or being a nurse or working as an executive, all tough. Where does the optimism come from?
There wasn't a moment. It just kept happening. And I think part of it was I was receptive and wanted things to change. And I did. That's why I quote Drucker. I did listen to people and I was willing to say, oh, you're kidding me. I had no idea that's how that worked. Really? And, but let's work together. And so there wasn't one period of time, but it became apparent as time went on, seeing, a number of things. I gave that great example because it's just so clear and easy to understand. The grants ran out. The fabulous program that we had was going to have to shut down, and we had to go get the big time money and the hard dollars. It's a great one to do it. But I saw a lot of other changes over time that occurred basically on the same thing. We'd say, we really need to talk to somebody from the Department of Health, and we need to get that person in here because we're in an area that we're not able to do anything more about. And you'd invite them to a meeting and you'd sit down and you'd start talking and they go, we didn't realize that was such a problem for all of you. Let's talk about how we can all work together. It was very interesting. And I also think I was willing to say yes. I was willing to try different things. I got hired for a job. It's pretty funny. I remember sitting there at the beginning going, what am I doing here? It was to set up a managed care company. This is going back to the 90s. For a group of healthcare providers, and they had to deal with managed care. They were converting Medicare to a managed care product, and people really didn't know what to do. And I got hired to run it. And the first thing I did was hire 2 people to work for me who'd been in the insurance industry. And I said, look, I know a whole lot about the delivery of healthcare and what we're trying to do for our patients, but you know about this payer side of it. And we need you at the table. And we got them at the table. And then we proceeded to go out and meet with so many different groups of people. At that time, it was a statewide program. And then we finally moved into a regional program, and we started connecting with people in Westchester County and some people in Boston and also Rhode Island. But it was a process. I did say yes. Now, really, with the first meeting, I went, okay, this is going to be interesting. But I learned a lot and saw success and enjoyed it. And that's part of the reason I wrote the book.
That's wonderful. And speaking of the book, I always wrap up these conversations, Judith, by taking folks behind the dedication. And you dedicate yours to in honor of Walt, who told me, keep your eye on the star always. Tell me about Walt and why it was important to dedicate the book to him.
Well, Walt was my husband, and he said, keep your eye on the star always. And he had listened to me over all these years talking about these jobs I'd had, and I'd come home and, he'd say, how was work today? And I'd start going on and on. He'd ask me tough questions. And, yeah, so when I came up with this, I started the star. I was actually doing a consulting gig for a group of insurers, and I created the star as part of that. And then I started using it in other places. And so I've had the star been hanging out with me for a long time. but it's been writing the book. And what I do in the book, and you probably saw this, is I break it into 3 parts. At the beginning, I give this basic discussion or description of the U.S. health system and how we got to where we are today. And then the second part of the book, I take each sector of the star and I break it down. And I say, this is how it works. This is how it relates to other sectors. And I also describe something called there's the triple aim and there's the hidden triple aim. And I don't know if you saw that, but the triple aim came out around 2004 out of a group out of Boston, and it was quality of care, population health, and cost effectiveness. And when it first came out, people responded to it like, what? It's called the Institute of Healthcare Improvement out of Boston. Very, very prestigious organization. But after a number of years, not months, years, people began to really incorporate the triple aim into their healthcare planning and what they were doing. Well, I created something for my book called the hidden triple aim, which is power, control, and money. And those items are floating around and are very real in the U.S. healthcare system. And there are big issues with power, there are big issues with control, and there's big issues with money. And, it's you got to know about it. You got to realize that it's there. And when you're making change, you have to address those issues. And so I write about them, and I write about them, again, 205 pages, you're only going to go so far, but I write about them in the 5 sectors. And then in the third part of the book, I come up with 4 paramount issues that really have to be addressed. And one is the health of the population. Gets back to your consumers and your patients. And we have huge discrepancies in our population. It is not equal for everybody. And I do get into data there, and I present data. It's a big issue, and it's a huge issue for our country. Second one, of course, is the high cost of care. And what are we going to do about them? How are we going to control that? The third one is consumers versus patients. What's a consumer? What's a patient? And how do we begin to see people as consumers of healthcare, not just patients, not sitting there silently being told, now you're going to do this, take this pill, now you're going to do that. You also have to say, should I change how I eat? Is there something that I should be doing more that I can do on my own to take care of this? And that's a consumer model. And healthcare providers have to be willing to do that because guess what? We make a lot of money when we cut people and when we do all these tests, et cetera. And so we have to really think about how are we going to, as healthcare providers, work with a consumer model of care too. It's very, very important. And then I do, 7 or 8 pages on AI and what's going to happen with AI. How are we going to bring AI into healthcare? How we're going to use it. I know people that are working on it right now in terms of operations, managing operations. This is cool. AI diagnosing, no. And the New England Journal of Medicine started a separate journal on AI in, I think the first edition came out in January of 24. And the editor came right out and said, we cannot use AI to be doing diagnosing and making treatment plans. That's still our role as healthcare providers. So I go into a fair amount of detail about AI because it's a hot one.
Well, awesome. Well, you can read all about it in Judith's book, The Center of the Star, Understanding and Changing the U.S. Healthcare System. Her name is Judith Kunisch. Judith, thanks so much for the time. I really appreciate it.
Thank you, and thanks for the opportunity to talk about it. I appreciate it too. Take care.
And that's going to do it for this episode. If you want to find out more information about Judith and her other amazing authors, go to theauthoritycompany.com.